Hello. So today we're going to be discussing about different types of arthritis. Now before we dive into each specific type, it's wise to talk about a systematic approach to joint space narrowing, which is the most common and consistent finding that we'll be seeing in radiographs of patients who are being investigated for any arthritic problem, right? So joint space narrowing can be broadly divided into asymmetric and symmetric joint space narrowing. So what does this actually mean? So let's see two knee radiographs, frontal projections. Here you can see this is the medial compartment of the knee joint. This is the lateral compartment of the knee joint. Medial compartment, lateral compartment. So what is happening in this radiograph? There is severe narrowing, asymmetric, severe narrowing of the medial compartment. The lateral compartment still seems okay. Why is this happening? This radiograph has been taken with the patient bearing weight in an erect position. So when a patient bears weight, the medial compartment of the knee joint bears the maximum brunt of that weight, and therefore in degenerative joint disease, it is that weight bearing portion that suffers the maximum damage. Therefore, there is asymmetric joint narrowing in degenerative osteoarthropathies. In contrast, in this radiograph you can see diffuse symmetric narrowing of the knee joint space, medial as well as lateral. So this is more suggestive of an inflammatory arthropathy. What happens in inflammatory arthropathy? The entire joint is lined by articular cartilage and synovium. So it is a diffuse process of the articular cartilage as well as the synovium. Therefore, the entire joint space is symmetrically narrowed. So that is what is the first step that we have to do. Once we have found out that it is a degenerative osteoarthropathy, there can be typical changes of osteoarthritis in an elderly patient. Suppose there are certain unusual patient population. Suppose if it's a younger patient, suppose there is an unusual distribution of joints or unusual distribution of severity. Certain other differential diagnoses should come in our mind, like trauma, crystal deposition disease, Charcot's arthropathy, or hemophiliac arthropathy, and several more. Okay, so this was about degenerative osteoarthropathy. Now, if there is symmetric joint space narrowing along with erosions and soft tissue swelling, we have to think about inflammatory arthropathies. Once we have come to inflammatory arthropathies, we have to see how many joints are involved. In a monoarticular involvement, the first thing that we must think about is infection. Septic arthritis usually presents as monoarticular arthropathy, right? If there is more than one joint involved, then we see what is the distribution of joint involvement. If it is predominantly proximal, that is, if it is predominantly the hip or the ankle joint that are involved, or the first metacarpophalangeal or the proximal interphalangeal joints that are involved, with no bony proliferation as such, then we are looking at rheumatoid arthritis. Suppose it is the distal joints that are involved along with bony proliferation findings, then we are looking at seronegative spondyloarthropathy group. Under seronegative spondyloarthropathy, we can further classify it into axial as well as peripheral spondyloarthropathy. If the spine or the SI joints are involved, then we are looking at ankylosing spondylitis. And if it is the peripheral joints that are involved, like small joints of the hands and feet, then we are looking at psoriatic, reactive arthritis, IBD-associated arthritis, SLE, sarcoid, and various others. Right? So this was the basic approach to joint space narrowing.